Our patients have been left stranded at the Federal Psychiatric Hospital, Kaduna, as nurses embarked on an indefinite industrial action, crippling activities at the facility. Our reporter observed that several wards, including the senior citizens and toxicology units, were deserted, with patients and their families seeking alternative medical care. The report.
The chairman of the union, Ewenreji Okechukwu, said issues relating to staff welfare and surcharges have remained unresolved for over 2 years, despite repeated engagement with hospital management. The union expressed dismay over unmet demands and lingering welfare concerns.
Management are not looking into that, rather they are holding on to the services of the contract workers. I don't know whether we are in private setting. We are in a government setting where permanent workers are supposed to discharge their duties, but they took over locum workers to work for them. If you go to some ward now, you see about 45 patients being cared for by one nurse, and they are suffering. And yes, one locum nurse, and they are suffering, and we are saying no to that. Let them solve this problem for us and let us move ahead. And that's why we are here. We are not here to fight. We are friends of the hospital, and we must remain friends of the hospital because nurses are at the pillar of healthcare.
It has been observed that there are some individuals, our nurses, who were employed. For example, we have nurses who are graduate nurses. Based on the scheme of service, these graduate nurses, once they come with their own degree in nursing, they are supposed to be placed on Conhes 9. But we observed that some of them were placed below Conhes 9. And we try to bring it to the notice of the management so that there is going to be an adjustment. It's part of what we've mentioned to them, and they could not be able to do anything like that. Instead of them to look into this, they refuse to respond to our own plea.
Responding to the development, the hospital management, through the head of finance, Loki Abumere, expressed concern over the strike and assured that efforts are underway to address the grievances and restore normal services.
As it is today, there is no board. Usually there's a board of management. There's no board. So our next responsible authority is the Federal Ministry of Health. This matter have been formally reported to the Federal Ministry of Health. And as I speak with you, Federal Ministry of Health is fully aware, and then they have assured us that they will wade into the matter. So we are awaiting the intervention of the Federal Ministry of Health, being our employer. So we are talking to them. If they can come to understanding, look, this is it. If there are things we can do eternally, why not? And they also know what management keep doing for the staff. It's a priority.
At the time of filing this report, wards accommodating psychiatric patients remained deserted, with some units under lock and key, raising concerns about continuity of care for vulnerable patients. Bello Musa, Trust TV News, Kaduna.